All right, we have a quorum then, right, Amy?
Yes, I'm here.
Thank you. We were talking about the minutes, um, and we were doing the, Wednesday, July 16th ones first, and Ellen made a motion to accept the minutes as written, and we were looking for somebody to second it.
So I will second it.
Thank you. Is there any discussion on the Wednesday, July 16th minutes? No discussion. All those in favor of accepting the Wednesday, July 16th, 2025 minutes as written, please say aye. Ellen,
Aye.
Amy,
Aye.
myself, aye. Thank you. Those minutes are accepted unanimously. Then we need to do the Tuesday, August 5th, 2025 meeting minutes, and I've read those. Don't have any questions or edits. Anybody would like to make a motion?
I'll make a motion to accept those minutes of August 5th, 2025.
Thank you. Is there a
Special
second?
meeting minutes.
Thank you.
I
Second?
second it.
Thank you, Amy. Discussion? All those in favor of accepting those minutes as read, please say aye. Ellen?
Aye.
Amy?
Aye.
Myself, aye. Thank you. Those minutes are accepted. Okay, we're on a roll. We're going to move now to the health director report. Our new health director, John Boulay, has been here, I think, a month. Have you been here a month, John?
Uh, not quite. A
Not quite.
little over
Anyway,
3 weeks.
3 weeks, and he's doing a great job. I've been in the office a lot, and absolutely thrilled, John, that you're here, and you're super easy to work with and a joy to have around. And so we're looking forward to your report.
Thank you. So basically, we have 5 different septic systems in the process of installation in town right now. I've been going out and doing field inspections for those. There's another 2 that went through soil evaluations this month, and along with it, I believe another 2 that had scheduled soil evaluations for the upcoming week. Um, we had a couple residents call in this month with issues with bats in their homes. One was a family on vacation that was in a different state. We had to work with epidemiology through the state of Maine to basically figure out how to handle that situation. It ended up that Maine took responsibility for that bat. And then we had another resident in Topsfield that had found one in their kitchen. And Sue and I worked with epidemiology on that one to make sure proper protocols were followed. And they didn't believe there was any exposure to rabies because they were never asleep when the bat was seen. Other than that, we're just trying to get rid of ready for the Topsfield Fair. I spoke to Kate from Topsfield this past week. Also working with John Coulon to try to figure out just a plan for how we're going to handle the fair. And that's pretty much it.
Wow, you make it sound sort of easy, but I know there's a lot of stuff going on. Um, Anybody have any questions for John? Okay. I know we've had some plans come in, and we've had a consultant, John.
Yep, and Tom Minetta is handling the
Mhm.
consulting for the project at Alfalfa Farm. He's kind of in the middle of that process right now. I believe he's waiting on some data for stormwater that I heard today. They should be getting it next week. So he should have everything he needs once he gets that.
Okay. Thank you. And okay, so that anything else? No. All right. Thank you, John. Um, Now, the next item is a report from our Tri-Town Public Health Nurse, Julia Lobel, and Julia has been doing a great job as usual. So I do want to spend some time hearing about um, what you've been doing, Julia.
Good. So as starting with Maven and communicable diseases, nothing out of the ordinary for that. There was an additional bat case this week that we're dealing with. The state epi was working with the resident doing the exposure assessment and then determining if and how the bat will get tested. So we're kind of waiting on some more information on that still. The Topsfield Fair, the plan is to begin coordinating the MRC volunteers and the students from schools to staff the triage area at the fair. The fair is working on actually a porch or like an overhang for that public safety building. So I thought that was nice. They asked if there was any requests or upgrades for that area. And in previous years, I don't know if anybody's been over there, but it's full direct sun on that building. And so it's blinding. People have actually gotten sunburns sitting doing their volunteer work there before. And so I think they're going to work on getting some type of permanent structure put up on that building next to the police building. So that's good. That'll be good for everyone. And then it's the same plan as previous years as far as staffing and coordinating the volunteers for that area. So Chief Collins Brown was happy with that approach. The executive director from the fair was happy with that. So it sounds like it's just status quo with that. No changes needed, which is good. And then as far as wellness clinics and the Tri-Town Senior Visiting Program, I've continued to do the monthly clinics at all different locations around all three towns. There's a total of 9 monthly wellness clinics that happen for 2 hours around all the senior living communities and the councils on aging. So I did some of the math for this year for January to June, and there's an average of 4.5 people that are seen at each of these clinics. So certainly that's just the average. There can be one person, there can be 12 people, but on average, I see almost 5 people per clinic. And just some recent highlights. I kind of like to highlight some of the cases that come in, just some information. But one of the cases I had come in this week, it was somebody with a new onset of extremely high blood pressure. She actually came over, came over just to get I carry the file of lives from all the fire departments with me. So I give those out to residents when they come in to make sure that they have them. She actually came over just to get the refill for the insert. And then I said, oh, do you want to have your blood pressure taken while you're here? And she did. And her blood pressure was it was like 220 over 100. No other symptoms, no headache, no chest pain, shortness of breath, anything like that. But just cases like that really highlight the need for clinics like this in somebody's community because she was feeling fine, didn't have any other symptoms. I was able to do what's considered like a warm handoff with her. So I called her daughter, explained to her what my concerns were. She sat for a good half an hour. We rechecked it. It was the same for a long period of time. And I was able to call her daughter and talk to her primary care, and she was able to get seen that same day. So I've had other cases before that I've mentioned on these meetings where people come in and they have extremely high blood pressure, but they have other symptoms and they get transported off from 911. So this was a little bit of a different case where there was no other symptoms. It was more of an incidental finding. But that does happen a lot. I find a lot of either new onset of hypertension or maybe somebody that's been on medications for a while and their blood pressure has been creeping up and they need to have a med adjustment. So that's just one highlight, I guess, of some of the things that I do in the community. And then the home visits do continue from referrals from either the Council on Aging, from the directors. Sometimes the fire chiefs are calling in about residents that need connection to services. Sometimes it's family members. It's all different referral sources for when I do home visits for seniors in the community. I'd say the most common reasons for visits are typically related to dementia. So maybe somebody that has a new onset of memory loss, or maybe their symptoms are worsening, and I'm able to connect them with resources. So it's usually a partnership with the Council on Aging that we go out and meet with people, provide them with resources, things like that. The other common reasons that I'll go out and see people is if they've had a recent fall in the community and they don't have any connection to services. So if they don't have any services through age span or senior care, they might not have a life alert in place. They might not have any family members around, so I'm able to kind of connect them with other appropriate services. So I think that's been a good partnership. And to date, I don't have the exact number, but I do track how many people I see, and some people I see on a regular basis, some people I see on just a one-time basis. It really depends, but they're all voluntary visits. Nobody has to agree, for a visit. But I would say I do have a good success rate going out to see people in the community. And then the next thing that we're working on is the immunization plan for Topsfield for this coming fall. We talked about this briefly at the last meeting, and the tentative plan. I mean, my initial thoughts would be to host the same clinics that we did last year, to have the same type of outreach that we did last year. If you remember, there was some changes in June of 2024 when the VNA contract ended with the town. So we had to pivot last year and figure out a new approach for providing vaccines for the residents in town. And what we did last year was we partnered with Conley's, and Conley's was able to come in and provide 3 different clinics. So one in September, at the end of September, that was geared more toward the seniors in town, and the Council on Aging paired it up with an ice cream social for the residents. We did another one like mid-October and another one mid-November. And that approach really helped to take the strain off of town hall, in particular with the parking. So instead of having 200 people showing up on one day for 2 hours, this approach, number one, it provided more options for people, took the strain off of parking at town hall, but it also gave people more options. So if they wanted to get like a flu vaccine one month and then the RSV vaccine another month, I think overall everybody was very happy with that approach. We had good feedback and they were well attended. The other thing that we did last year is that we did order some private vaccines through the Board of Health. So we ordered some flu vaccines, we ordered some COVID vaccines, and then we were also able to order vaccines from the state through the Vaccines for Children program, so that I was able to provide vaccines for people who walked into town hall that maybe couldn't make it to one of these clinics. And then I was also able to accommodate the homebound residents in Topsfield as well with that privately purchased vaccine. So I feel like we hit a lot of kind of points doing this type of method. It's not that we're relying on just one outside pharmacy, and we're not relying on just the Board of Health doing this with one single clinic. And the other nice thing about partnering with the pharmacy is that we get to have all of the vaccinations available for residents. So especially in a time like this where there's like a lot of turmoil with vaccines and what's going to be covered by insurance, what's going to be necessary, it would be really hard to plan like how many COVID vaccines we needed to order or how many flu vaccines we should order. But the other thing is too with the RSV vaccine this year is that they changed the guidelines for that. So now it's anybody 50 and up is eligible for an RSV vaccine if they have underlying conditions, which is almost everybody that has some sort of underlying condition that would qualify. So there's going to be a lot more people that qualify for vaccines. The COVID guidelines are still unclear at this time, but it's likely that everyone over age 65 and those that are at increased risk will be eligible for a COVID vaccine. So I think we learned during the COVID pandemic that having consistency with these clinics and having the immunizations as easily accessible as possible, kind of meeting people where they're at, was really the most important response. I don't know if there's any particular questions on that or if anybody had any additional thoughts. Always open to
Is there
discussing things. And
is the new a new vaccine out yet?
it's not out yet do you mean for COVID or?
COVID, yeah.
For
Sorry.
COVID, it's not out yet, but there is going to be a 2025-26 formula available.
Okay.
So it would be a more targeted vaccine.
Yeah. Yeah, I'd read recently that there's another strain out there, so hopefully it will include that.
Yeah, I think that it will. It depends on, but the nice thing about those the vaccines, the mRNA vaccines, is that they are easily like adjustable too, so they can kind of pivot if there is a brand new strain out and get a new vaccine out.
Sounds good.
I really appreciate all your hard work on the clinics, you make it sound easy, and you also make it sound very clear of what you're doing, and I know it isn't easy because 'cause I've done it myself, and you're navigating a very un almost like the ground is shifting under you all the time, under us, with all these different vaccines, different guidelines, and now um, the ACIP being disbanded and reconfigured, and them changing their recommendations in the middle of the while we're trying to plan. It's not easy. I personally am very, very, very pleased with the way the clinics went last year and how they're being planned similarly this year. I can't imagine um, doing anything else or doing more. Um, so I know there's some pressure for Julia to do more different things. People get an idea and they just say, Julia, we want you to do this. And you can't just, can you tell us how this aligns with the deliverables and the guidelines for the PHE grant, the shared services grant?
Yeah, I don't have the exact wording in front of me right now, but part of the communicable disease foundational public health services do include expanding vaccine access. So it uses language like expanding vaccine access, meeting, helping underserved populations, homebound populations, things like that. So it doesn't specify anywhere like one particular way that you have to provide this service. And certainly it's not even like a law or a requirement to provide immunization services, but we certainly know in Topsfield with no pharmacies available, and then also with no primary care, we do have a new pediatrician in town, but there are no official like primary care offices in town where somebody can just, roll in and get their flu vaccine. So it does make access more difficult in a town like Topsfield, and Boxford is similar. So I think that's a big consideration for any outreach that is being planned. If we had a CVS and a Walgreens and multiple doctors' offices, then I think our approach would certainly be a lot different with our residents. And also, I know the Board of Health has a long history of providing these vaccines for residents. So residents have really come to expect the service from the town, and I think just changing it up would be it wouldn't be a service for the residents at all. But I do think we meet the foundational public health services already with what we're doing.
Yes, I agree. Thank you. That's a good summary.
Can I ask
Um,
you a question about the fair, Julia?
Yeah.
Um, you mentioned that the MRC and students, what students are you involving?
So that's a good question. So in previous years, I've partnered with Essex Tech with their medical assisting program, and I've also partnered with Masco for their EMT program. So
Okay.
any students that are in that, I typically ask for seniors in those programs. We may consider offering it to juniors this year too, just because seniors have been out on like work study. So I don't often get a lot of them. But it is a good partnership with the schools to get some of those students interested in the medical field. There was some discussion even in the past about maybe involving some of the explorers from other towns' police departments, but that hasn't really gone anywhere, so I'm not going to push that. But it
Okay.
is a good opportunity for students. If students are there, that's one of the times when I would be there with them. So we do have some very seasoned MRC volunteers that have done the fair now since we started doing it in 2021. And those folks can certainly be on their own at the triage area. But if I have students there, that's an opportunity for me to come and be on site with them and explain to them what we're doing, but also oversee what they're doing too, so they're not giving out wrong information to anybody. So.
Yeah. Yeah. Okay, good.
that's so awesome. It's absolutely terrific. And I had a question from somebody. What is how do you interface with the EMTs? So just give us an example.
Yeah, that's a good question. So what the ask was from Chief Collins Brown in 2021 was that she needed an additional layer of support. So a lot of what they were doing initially was just kind of fielding calls. So people would come over to that public safety area and be asking questions about where are the bathrooms? Can I get a Band-Aid? I need an ice pack. I'm looking for the Ferris wheel. Like all these different things that EMTs, police officers, firefighters didn't need to be sorting out. So they needed to be available if there was an incident on the grounds to be able to go and respond to. So how we interface with the EMTs is when the table is set up in front, basically. And then anybody that approaches that public safety area, so outside of, it's on the Route 1 side near Essex County Co-op. If anybody approaches that area, the volunteers would greet them, essentially, find out what they need. And if they are just looking for directions, they would, would point them in the area of the information booth. If they needed Tylenol, they would send them to the souvenir booth to make a purchase. If they needed, sometimes we've gotten like lost person reports, then there's a radio that myself or the volunteers use to call it in to incident command. And then it would get dispatched that way, essentially. So they're really just sorting out, they're literally just sorting out all of the information that comes in. If it's something that's more medical, there's a self-help kit that's there. So the majority of things that come over, people need a Band-Aid. They need a simple Band-Aid. And that was one of the issues too, is that if EMTs provide any medical care or any type of interaction, they're supposed to, there's like however many pages of forms to sign off on. But so with the self-help kit, if it's something minor like that, people can help themselves to a Band-Aid now. So it just makes it a lot easier. It was such a simple thing to put in place. And then if there is a medical incident, like if we've had an allergic reaction to a bee sting or something that requires transport, we had somebody that got cut one year that needed stitches, then EMTs come over and they are the ones doing the evaluation. So it's not me as the nurse that's doing, of course, I am doing some of the evaluation just because I'm a nurse, but it's the EMTs actually that come over and do the evaluations and decide about transport. Does that
And
make
then-
sense?
Yes, I was the person who brought you the person who needed the stitches.
Okay, yes, yes.
And wow, that was incredible. Yeah.
And so we've written up very clear information like job action sheets for the volunteers. They get that information ahead of time. They're made aware that it's not any hands-on first aid that they're doing, that they're there to greet and sort out the information. And we also track, we log every interaction that comes up to the booth too. So I'm happy to share that at some point. I probably shared it after the fair last year. But there's typically around 10 to 12 interactions like per day from the MRC volunteers or myself and the students. So it's definitely a worthwhile approach. But we're not doing anything that the EMTs would be doing. We're just sorting out, and we're not responding on. Somebody said that once too. Oh, you must have to go out on the grounds a lot to respond to stuff. And I said, no, that's what the EMTs do. So the EMTs, if there's anything medical on the grounds, they go out, they respond to that. We're not even involved in that. And then, if there's anything fire related, the fire department would go out. If there's anything police related, the police would go out. And another good example from last year was there was actually somebody on the spectrum that was having a really hard time navigating through the fair. It wasn't one of the sensory friendly days. And that person was having a hard time. They were trying to get to their car to get their medication. And she was trying to get a ride because she was in like sensory meltdown mode at that point. She couldn't get a ride from the police department because they just didn't have any vehicles available. They were all responding somewhere. And then she was trying to figure out. So I was able to, take her in, kind of keep her calm for a couple minutes, talk to her, get her out of all of like the stimulating lights and noise. And we were able to collaborate with the police department once somebody was available and get her where she needed to go. So it's just sometimes simple things like that, or sometimes it's vendors that are on site there that might have something that they need to get seen for. It might not be an emergency where they need to get transported, but they might need medical care. So we're able to provide information about like the local, providers, urgent care, things like that for them. So it's sort of all different things that come up. You never know what you're going to see, but the majority is Band-Aids and bee stings and ice packs.
That's awesome. Can you give an estimation of are you there every day, and if you're or how many hours, how much time do you spend there?
So it depends on the day. So if somebody cancels, then I will go over and fill in for them. But typically all the shifts are pretty well filled. So like last year, what I did is I went over in the morning when I first got in, like 8:30 and between 8:30 and 9, got everything set up out front there. Um, so got the table set up, got all the supplies set up, and just checked in with the volunteers, the MRC volunteers, because some of them were new, reviewed like the job action sheets, and then I was able to go off after that and do if I had a wellness clinic, if I had to go see somebody, I'd be able to go off and do that. Um, and then there was some of the weekends that were busy that didn't have enough volunteers. I was there on the weekends for some of those shifts, and a lot of the weekend shifts end up being students. So I'm there because there's students there too. I think there was maybe only one or two shifts. I could go back through my notes where there was no student and no MRC volunteer. But it's actually the MRC volunteers really like doing this event, and it's a good opportunity for them to get into the fair and to do some public, service, and it's interesting for them. So a lot of them are the same volunteers that have been doing it since 2021, and they have like their particular shifts, and they sign up and they get their friends to go with them. So it's been a really good partnership, I'd say, between public safety, the health department, and MRC.
That sounds great. You've got it running really smoothly. And the other thing, that I came up with a brilliant idea, which is about 2 years behind the time, that the trailer that we have for emergencies, I said, "Hey, we could tow that over there and use that for, a center for the inspectors to meet." Julia said, "Oh, well, we did that, and, there's no room for the trailer anymore, but the public safety people did give you this building, and that is a place for the food inspectors to meet and to sort of a base of operations." Is that right?
Yeah, that's correct. So the area that the triage is set up in, so there's two buildings right there. One of them is the command center for the police department. So they move all of their equipment there. They're there for the whole week. And then the other area, it's the building right to the right. And so it's like a shared space, I would say. So all of our stuff from the health department is in there. The fire department has their stuff in there, but it's pretty much available for the MRC volunteers. The health inspectors would be in there last year doing any of their paperwork or follow up. So it's really a shared space at this point, and it's given the health inspectors a place to kind of come back to in between inspections.
That's really important because years ago, the health director and health inspectors had a picnic table of their choice, whichever one was empty, and if it was raining too bad. But
Yeah,
I
I would
mean,
say we're very mindful of the our public safety partners, and it is technically their space. And they keep all their radios in there. They come in and do shift change in there. But I'd say it's been a very good partnership. I don't think there's been complaints on either end about sharing the space.
it's super. It's beyond my wildest dreams. So I I really applaud that activity that you're doing. And plus, I mean, obviously it involves the three towns, um, but a larger area because it draws from many towns. We've got um, all kinds of things that happen in Topsfield for those 11 days that other towns don't have. And we
Yeah, and people forget that it's considered a mass gathering. So there's over 500,000 people that come through the 11 days of the Topsfield Fair. So it's a very big event. It requires a regional response from both police and fire. They have their regional teams that come through. I mean, there are the bomb sniffing dogs that come through in the morning. This is actually a very high security event, and it's really important to have that partnership on all different levels.
That's fantastic, Julia. You've given a great summary on that. Is there anything else that you needed to cover other than all the things that you do? Oh, I just wanted to comment on the clinics that you do in the councils on aging, having done them myself. This is um, it's quite something it's one thing to work in a hospital where you have people who come in and you know their whole history, you have their entire medical record, you have a whole team of health professionals around you to call upon, or to work in a doctor's office where you have their entire record. When you're in public health and you have a clinic for the public, people can just walk in off the street. You've never seen them before. You have no idea of any of their underlying conditions or anything at all. You are starting from scratch, and you have to do assessments on the spot. It's really a skill that I don't think is appreciated, and you're walking a fine line between doing things that are inappropriate, not doing enough, doing too much. Um, and it requires incredible judgment. And so I really commend you for doing that and um, and doing it extremely, extremely well. And we also welcome the guidelines from the Shared Services Initiative, where they're trying to make some a little bit more specific guidelines where there were none for public health nurses, and I can attest to that. So
Yeah, one of the key things that they're talking about in the public health standards is this connection to clinical care. So these wellness clinics do highlight that because I'm able to connect people. I had to do at the beginning of this, I had to do a lot of research into what services are available, what the Council on Aging offers. I mean, it's even just different between the three towns. Like Topsfield uses senior care as their elder service provider, and then Boxford and Middleton use age span. So it's just because of the different regions. So there's two different elder services providers, but then there's also just all different state providers. So it's not private providers that I'm referring to. It's just any public providers for services. And you have to do a lot of research on that. But also, I had somebody one time that needed library books delivered. She was recovering from a surgery, and that was her request. So, the very beginning, I had to go around to the libraries and find out about their library delivery program, and talk with the Council on Aging about these different services because I had to know really the same thing that the Council on Aging directors know if I'm out in the community. I've also had to connect people with food pantries, with the mobile food trucks that come around. And then just all different services. We created like a resource guide for providers, healthcare providers in the area. So a lot of it comes just as people are asking, but there was definitely a lot of work to get it up and going and to keep it up and going. But is there any other questions on? I just wanted to highlight about North Shore Mothers Visiting Program too.
yes, please do that. Yeah.
So we have continued offering universal home visits for new mothers by sending out the Welcome to Parenthood cards in Topsfield and Boxford. The shared service coordinator and the clerk send them out from Middleton. And there's been just ongoing discussion about how this program will meet the state requirements for maternal and child health initiatives. And this program, and certainly Topsfield and Boxford and Middleton being in this program, will meet that standard. There was also a recent spotlight from the Office of Local and Regional Health on North Shore Mothers Visiting Program. It gave a nice background, a summary of the background of how the program came to be. And then it also mentions how the program has grown and now includes other municipalities like the Tri-Town. There's some other towns north of us too that are joining the program. So it just goes to show like a lot of these programs are just grassroots programs. Nurses in the community see a need and they develop a program and then kind of try to expand it from there. So a lot of these programs aren't written already. It's just something you have to do by doing your community assessment and figure out what the needs are in your community. But if you haven't taken a look at that spotlight from OLRH, I would recommend that because I thought it was a really nice write-up in there.
It looks interesting, very interesting.
Yeah, and then so when I first started getting information about this program, the North Shore Mothers Visiting Program, I thought it was a great program. But when the information was presented at one of the conferences, the nurse who presented highlighted that there was, I think it was for Peabody, there was 550 births and she got 55 visits. So in my head, I'm doing the math, like a 10% return on these cards that are sent out. And I'm thinking, well, in Topsfield, if we only get 30 births a year, let's say, that's only 3 visits a year. That's not really great outreach. So then from all of that information that North Shore Mothers Visiting Program, I was able to pare through that and start a safe baby class. I named it Safe Baby Class, and it's I've talked about this before, but it's the infant CPR, maternal mental health, maternal health. I go over the post-birth warning signs, safe sleep, and home safety. So it's all programs that are from CDC or Mass Department of Public Health, and I've just kind of put it all into one. I did hold the last class in July, on July 21st at the Topsfield Library, and we actually had 7 participants. And one of those participants was the other regional nurse for the North Shore PHE. And she liked the program so much, they're thinking about starting it up in Beverly on that same program. So there's been a lot of positive feedback on that program and just a different approach to providing really the same information in your community, but in just a way that kind of gets more people into the library where they already have baby classes for different things. They have reading programs, music programs, things like that. The one thing that I am looking for, I need to investigate either like some grant funding or private funding, because the CPR books I give out at that Safe Baby class are not covered by the PHE grant, which seems very strange. All of the nurses agree there's no reason they shouldn't be covered. They cost about $3 a piece, so I've been just purchasing them on my own at this point because there's no reimbursement, so that they're available. Not everybody takes one, I would say, but they are available. And then there's also these post-birth magnets that I'd really like to give out to people. And those are like $60 for 50. And that's another thing that for some reason the PHE grant won't cover. So if anybody knows of any private funding for something like that, I'd be interested to hear about it.
Hmm.
And then the opioid task force, the last meeting that was scheduled for July was canceled. There was scheduling conflicts. I believe there is another date coming up, but I don't know what it is. I haven't seen it come up on my calendar. And then there was recent data from the Bureau of Substance and Alcohol that there's been a 40% decrease in opioid-related deaths. That's really significant. And hopefully those numbers will continue to decline. We are still giving out Narcan, and I'm still providing Narcan training at all the CPR classes that I do. So it's still in discussion. And then just on the PHE update, there is a meeting. I have a meeting this coming Thursday with DPH, Office of Local Regional Health, and then the Middleton as the grant host to just iron out some of the work plan, things that have come up, some of the questions, comments, things like that. So that is this coming Thursday at 1 o'clock, and it's there'll be multiple people there on the meeting. And then hopefully they can address like the actual work plan that I've submitted, job description, the contract. There's been a lot of confusion on those items. So hopefully that could get ironed out so that the role can be clarified. And then there is a social worker that's been hired through the PHE. It's somebody, Dr. Burns, Jennifer Burns. She was hired for 4 hours a week, from what I understand. And there is a meet and greet on August 28th at 1:30 in the Middleton Library. So Dr. Burns has an extensive history with substance use and mental health. I'm not sure how her hours are going to be split up, or if she's going to be remote, or if she's going to be on site, or what the plan is for that. But she will be a good addition to the team as a resource.
Sounds good.
That is super, Julia. Do you need any support on the during that meeting on Thursday from any of us?
I'll be in Topsfield doing the meeting because I have a CPR class right after.
Yeah.
So if anybody wants to be there, I mean, I'm going to be right in the office doing the meeting. So
Oh, is it a Zoom meeting or
it's a Zoom meeting. Yeah.
Zoom meeting?
Yeah.
Hmm.
What was the date again?
It is this next Thursday, the 28th
Okay.
at 1 p.m.
Oh, wait.
Wait, no, it's tomorrow.
Tomorrow.
Sorry, the meet and greet is next. Sorry, the meet and greet is next Thursday. The Zoom meeting is tomorrow.
Tomorrow at what
At
time?
1 p.m. 1
1
p.m.
p.m. by Zoom in our office?
Yeah.
Okay.
So it's certainly not a requirement for anybody else to be there. Middleton is the PHE host, and I think they had some questions. It seems like we're getting kind of mixed messaging from the state For example, on the wellness clinics, they wanted me to discontinue the wellness clinics in the community when literally the week before I had been on a webinar with the state, with the Office of Local Regional Health and Rural Health. And they were saying that any wellness clinics that can be done in the community are valuable and that there's no way to quantify the value. So we're getting like mixed, so like that in particular. Um,
Hmm.
yeah,
Well, that sounds
very confusing.
good. I hope that it all gets straightened out. I'm glad you've got OLRH in the room there. Is somebody going to record the meeting?
I don't know. I can find out. That's
You
a good
should. Is
question.
it, you
Okay.
know, someone should, may preferably you. I
Okay.
mean, there needs to be a record of this because the confusion needs to stop. And um, I think I'm glad that we took the time, that we had the time to listen to you tonight, because one thing I hope that would come out of this is that we can um, basically record and our support, our support, our total support for what you're doing. And I can't imagine you doing anything differently or anything more. You're doing so much, and a lot of it is your own initiative. It's it's unbelievable what you have accomplished. I think I speak for all of us when I say that Topsfield is very, very, very happy and pleased and
Thank,
satisfied with everything that you're doing.
thank you.
If somebody disagrees with me, say so, because
No disagreement.
okay, we all agree. We can say that. Um, and if you think of some other way that we can support you, um, just tell us. Just call on us.
Yeah, I think sometimes what I struggle with is like what I do is do the community assessment, whether it's through looking at data or talking to people, and then also pairing that with what the state is looking for in these foundational public health standards. But I think sometimes I have a hard time expressing how those things come together and like speaking that DPH and getting the right language down. So like I know that it's following what DPH is looking for, but then there might be room for interpretation of somebody else that it's not needed or it's not what DPH is looking for. So
Sure.
yeah, I think
Yeah,
sometimes just the message gets mixed up and
sure. Yeah,
I'm good at doing things and just not talking about the reasons behind it, I guess.
you're very good at talking about it. Other people aren't so good at listening, I think. But the other thing is that uh, for the advisory board, do you happen to know when that next meeting might be?
I don't.
No, that's a big question. Um, we're um,
Kevin should know.
right. So that's a we'll have to find that out. But as I have pointed this out to various people, as an advisory board, I don't believe we've ever received the 2026 deliverables, the 2026 budget. Um, what's the other thing? Um, deliverable work plan, a work plan officially a work plan template. I can remember when Topsfield had the grant, there was a specific template. There was a specific something asking in very detailed way, give us your work plan and be very, very detailed about it. We've seen none of that. So I'm hoping this is not for you to do, Julia, but I'm hoping that the next advisory committee meeting will have those things on the agenda and that the things will be provided by the coordinator to the committee, because how can the committee advise without any knowledge to go on?
Right.
So, and I'm not on the advisory board anymore. So I'm hoping to ask the people on it to ask for those things and have them provided.
Well, as you know, I'm the alternate,
That's right.
but I that wasn't received well that, I should be on any list to receive anything. So I specifically asked to be, get announcements for the next meeting and all the information. So, but I haven't received anything.
Yeah. So it's probably because a meeting isn't planned. And I know for public posting is you only need 48 hours, but even to get that's not enough time.
No.
And you need to get the materials beforehand so you can look at them. So
Are the meetings monthly at this point? Do you know? Or I know it's required a minimum of quarterly, but a lot of PHE groups are meeting monthly. At
that's
least
the
until
thing.
they get everything ironed out.
Yeah, I don't know that
I don't think
any
that decision has been made.
right,
I'm not aware that that has been made.
right.
But yeah, we really should be meeting on a monthly basis because there's a lot of questions.
Yeah. And Kevin told me that he thinks it should meet monthly too. So
Okay,
um
maybe he'll
I
be
think
out.
yeah, I mean it wouldn't hurt to yeah, we'll have to be a little more assertive in not a little more, a lot more assertive in making these things happen the way they should happen.
Yeah. As far as meetings, the next opioid meeting that I have, um, Debbie had given a date to me was September 18th
Uh
at 10 a.m.
something else is happening that day.
And I can't be there as I'm going to be away.
Has any of that money been spent yet?
Yeah.
Julia?
Small amount.
What?
Yeah, a small amount from the pharmacy take back.
Oh,
I don't have the exact numbers.
yeah. Okay.
And just to go back for the immunization clinic plan, so are we good to schedule with
Ah,
Conley's? Or what
that's
is thought on
that,
that?
that's a good. I don't know if we need. It seems to me we shouldn't need to have to vote on that, but would it be helpful? I mean, as far as I'm concerned, schedule Conley's.
Okay.
Is anyone else? Everybody weigh in. What do you think?
Yeah.
Because it's
Do it.
always been a decision of the board and the health director. Like it's not my personal decision. I can certainly help facilitate this, but there's lots of other plans that could be in place.
Far as I'm concerned, schedule it because it's already August. People, it's September 1st, the phone will ring and it won't stop. And people will ask when these clinics are happening, what can they expect? And
Yeah,
we better have something in place. And then also to get the word out to people, it has to go out in so many different ways now.
right. Okay.
So I think we can say it's a consensus of the board to go ahead and schedule Conley's to do the Topsfield um, vaccine clinics in the fall, as has been done in
Yeah.
previous years. Anybody disagrees? Say so. John Boulay, what do you say? Anything?
Yeah, I think it's good. Might
Okay.
as well keep it the way it has been.
Yeah, I mean, and this like Julie pointed out, it was only a year before that we had the VNA doing it, and Julia had to scramble last year to really figure this out. So it's only been this way for 1 year, and it was fantastic. So I'm looking forward to it. I will be at all three because I don't like to get my vaccines all in one time, so I'll have to get one per clinic.
Good. Okay.
So yeah. All right, Julia. Thank you for being here. Thank you for all that you do.
You're welcome.
Okay. Um, that covered the new business, which was discussion of fall 2025 vaccine clinics. Um, Julia also gave us public health excellence update, I believe, as much as we know. I don't know if it sounds like Ellen doesn't have anything else to add because you weren't. Do you have anything, Ellen, that you want to add to that item under old business?
No.
So
Oh no, not for the vaccine clinics. No.
Yeah, or the public health excellence update.
Well, the other thing was, and I don't know if anything, there was any follow-up, but in the meeting that we were having back, I'd have to look at the actual date. It got, what is it called? Um,
Advisory board or?
yeah, the advisory board meeting, but in the middle of it, it was, bombed.
Oh, that's right, it was Zoom bombed.
Yeah.
Oh, that's what Kevin said, but then did it come back into session?
Not to my knowledge.
Oh, so
I don't know if it, what happened. I didn't hear anything else about it.
oh,
That's why I'm saying that, I'm really not, I, I, I made a plug for being, the alternate should know in case Kevin couldn't be there. I need to know what's going on. But there's,
well,
there's no other alternate in the meetings.
yeah, which is neither here nor there. They're public meetings, so anyone can go.
Yeah, but you have to find out about it.
Exactly. So could I prevail upon you, Ellen, to um send an email to Kevin and ask when the next meeting is?
I I will.
And if you find out, you could email the board just so that we have a little heads up. Or I mean, I suppose you could CC Jessica or ask her directly, but like I'll leave that to you to figure out how to do it. But yeah. uh,
Okay.
Okay. Thank you. That's a good point. I forgot because Kevin came down and told us about it. And he said, "Oh, the meeting was bombed," and it was pornography, like the time that
Yeah.
the board. We didn't go into the details, but yeah,
Right.
that's quite the experience.
Yep.
Mm. Oish. Okay, so we're moving along to bills paid and monthly revenue. I didn't get a report of monthly revenue. Well, that only comes in when we have things to get revenue from, like vaccines, but um, we paid $100 for New England Medical Waste to pick up the sharps, um, $96 for the phone bill. That was in here twice, but I think it was a duplicate um, notification. Um, we paid $17 for mileage, um, $63 for Staples stuff, and yeah, all of that was from our own. Did I skip something? We're looking at so John is going to some very important he got into the soil evaluator course. Oh, that was something he forgot to tell us. So
Oh,
that's a big deal that he'll be going to, even during the fair, attending some stuff. So that's an important reason why John Coulon needs to help us and we cover the health inspections at the fair. So that $800 will be taken out of our line item, and we will definitely be seeking reimbursement from the PhD grant because it is a reimbursable expense from a reimbursable entity that puts on those conferences, and it's a required training. So obviously it needs to be reimbursed. And there's no other correspondence that I'm aware of. Does anybody else, did I forget something? Anybody else want to weigh in on anything? No.
when,
Okay.
when does
Mhm.
that course start? For John, when does that course start?
9/2.
Great.
Wow.
Congratulations.
Thank you. It's like 4 weeks long, so it'll be good.
4 weeks?
Yep. It's like every Tuesday and Thursday for about a month.
Is it all day Tuesday and Thursday?
Yeah, there's class and field sessions.
Wow. That's a new added challenge right during the fair so it's another reason why we need the extra inspectors. Lucky to have them.
Yeah.
Yeah, well, that'll be good to get done though. Fabulous.
Yeah, it should be good. Excited. You'll find it interesting.
Yeah. Yeah, hopefully you tell us a little bit about it.
Yeah, I will.
All right.
If you want to know about layers of soil.
Absolutely. You can't know too much about those. I've seen them, they're real. All right. So, motion to adjourn, perhaps?
I'll make a motion to adjourn.
Thank you, Ellen. Second,
I'll
45.
second.
Amy. All those in favor of adjourning, say aye. Ellen, Amy,
Aye.
myself, aye. The meeting is adjourned at 7:46. Thank you very much, everyone.